Good afternoon. Welcome to our webinar. I am so glad to be here with you guys. I have today as my special guest, Alyssa.
Hey, my name's Alyssa.
Alyssa is our front office manager, and she has been with us for
About almost 4 years.
almost 4 years, you guys. That is awesome. We're so lucky. But most importantly, Alyssa is getting married. Yay! And so we thought she'd be the perfect guest for our webinar today. And this isn't just a webinar about getting married. Of course, this is for any big event, whether you're mother of the bride, groom, you have a party, you have a cruise, etc. Or sometimes we just want to look better this year and want to know kind of what the steps are. So this is going to be really, really exciting. Couple things. There's going to be polls during this webinar. So I've only done this poll one other time before, so bear with us, but it's supposed to be interactive for you guys. Number two, we're gonna have these amazing promos. You have the opportunity to take advantage of those until tomorrow at 4 o'clock, end of day, you know, basically when our phones turn off tomorrow, 4 o'clock. But we do, just for scheduling purposes, we do have limited amounts of each one. I am opening some time to treat you guys. So these promos will be good for others in the office doing these treatments, but I am opening up a little bit of time to treat you as well. And finally, what was the other thing? I can't remember. So we'll get started. Okay, here we go. All right. So why does this topic matter? When you get married, or actually anywhere you go now, vacations, cruises, like I said, guests at a wedding, we've got these cameras that are so good now, and it sees every little teeny tiny pore. And I don't want you guys to obsess about this. I mean, my 14-year-old son is like enlarging his photographs and looking at his pores. And that's just something I never really thought would happen. So I don't want you guys doing that at home. But the point is, these cameras are a lot less forgiving than they used to. Like when gosh, I'm so old now. When I was growing up, it was like film, you know, and there was no like making it bigger.
Yeah.
Yeah. I mean, do you do that when
I zoom in?
Yeah, do you zoom in?
Absolutely not.
No.
No.
Okay, good. That's good.
No.
Okay, but tell us about your wedding. Is it going to be out in the natural light or is it going to be like indoors?
It is outside for the ceremony and
Okay.
then indoors
Okay.
for the reception.
So a
So
little
a
bit
little bit of a mix.
best of both worlds.
Yes.
So when you're out in sunlight, I feel like that's kind of where the pores can show, the texture can really show through.
Yeah.
And that's actually a place you really don't want to be wearing too much makeup, because I feel like when you're in natural light, you can really kind of see that, right?
It's gonna enhance, I feel like, the texture if I have too much makeup.
Right. We have a slide about that actually.
Yeah. No.
But anyway, so the point is high def photography puts a little bit more pressure on us. And like you just said, great segue. The makeup can enhance the texture. So this can help or hurt you. So if someone has kind of unhealthy texture or big pores, sometimes the makeup can settle in the fine lines, and that can actually take away from your appearance. And then, of course, everything leading up to the wedding, stress,
Yeah.
planning, lack of sleep, nerves, you know, events like showers, you know, receptions, you're not sleeping as much. You can get blotchiness in your skin, you can get breakouts. But if you have a good foundation, you're going to be a lot less worried about the effects that the stress will have on you. So, okay, here's our first poll. When is your next big event? So we will start the poll. Bear with us a second. See, look how you guys, this is supposed to be easy. There, polls. Okay, here we go. Launch. I'm gonna get the hang of this. Okay, tell me when your next big event is. Oh, within 3 months? Oh, you guys are awesome. Thanks for putting that. 6 to 12 months, just here for the glow. I love that too. Okay, so I'm gonna end the poll. Love it. Okay, so moving on. How do I end the poll? Just exit? Yeah, there we go. Okay, well, that was fun. Okay, so I was thinking about this and I figured when you're getting ready for a big event, there are four main things you should think about. Number one, texture of your skin, like we talked about. Is your skin dull? Does it have big pores? Is it blotchy? Those kinds of things can really, even though we have makeup can enhance, but you don't want to use makeup as a mask. You want your beautiful natural skin to shine through. Number two, brown spots. Okay, so if the skin is blotchy, our brains classify that as being older. So if you think about a baby's skin, babies are not blotchy. Babies have beautiful homogeneous skin. And so that our minds automatically classify as being youthful. Over time, we develop sunspots, we develop hormonal spots such as melasma. And so the more of this blotchiness we have, the older we kind of appear, even if we're not old. So we want to think about those. Of course, we want to think about wrinkles. So when we think about wrinkles, we think about wrinkles in motion or dynamic wrinkles, and we think about wrinkles at rest or static wrinkles. So when you're expressing yourself for a wedding, we want there to be some expression lines.
Really?
Yes, but you don't want to look like
Too much.
too much.
Yeah.
You don't want to look too frozen.
Yes.
Yeah. Or sometimes what happens, this is what happened with my own wedding. I had Botox, and keep in mind, I was like super young. I wasn't really doing Botox, couldn't afford it. And then right before my wedding, I had one of my attendings do the Botox. And I was like really frozen everywhere except my nose. So in all my wedding photos, wrinkles in the nose, bunny lines.
And those are the only ones.
Only ones. It drives me crazy. So anyway, the point is the Botox should be very balanced for an event or a wedding. And the point is for you to look natural, for you to have some sort of age appropriate lines, but not too many. And you don't want completely flawless face and wrinkles in one area. So I love doing Botox for weddings because I think it really brings out people's natural beauty and allows us to look super, super natural, but just enhanced and and so the patients feel more confident. And then finally, if we are feeling a little droopy, now you're so young, you don't really have that yet, but say someone is like older than you, if they're a bride in their late 30s or early 40s or beyond, we can feel like things are coming down and feeling heavy. And so we do have ways to lift up the skin and in a very natural way, make someone look more youthful, age appropriate, but refreshed. And we have these different options that involve minimally invasive to completely non-invasive. So we'll talk about each one of these. Okay, so going back to the texture, you can see how the women who are very beautiful in these pictures, but the makeup is sort of like not doing them any favors. So you can see on the left, she's got kind of blotchy skin. She's got some blemishes. You see on the right, that woman has pretty skin, but like the makeup is kind of enhancing the largeness of her pores. You can see some frown lines between her brows, and you can see her laugh lines kind of etched in. So the makeup's not really doing her any favor, especially because I think she has a really nice baseline of skin underneath. So we would enhance your natural skin without making you look older. So let's ask you guys, what can help you the most out of all these topics? What would you like to focus on? And here we go. Here's the poll. Maybe. 1 second. Stop sharing. Launch. Okay, here we go. So makeup not sitting smoothly, pores, texture. Anybody else? Come on, everybody throw something in there. Okay, so we've got pores. We have 0 acne scarring. Okay, that's good to know. We have some rough texture, makeup not sitting smoothly. Yeah, that's kind of what I was anticipating. So, moving on. You have worked here for almost 4 years.
Yes.
So you've done a few things,
Yes,
and we
yeah.
can build on that. But going back to texture, we've got, sorry about that, guys. Thank you. We've got medical grade skincare. So you guys, this is something that's so much better than what it used to be. The medical grade skincare has come leaps and bounds, and it really does make a difference. So as you see from this photo, we pick and choose from every line. So we take Everyline's hero products. We make sure that there's science to back it, and then we make sure that it's worth the cost and that it's, of course, safe and effective is always important. So I'd love for you to come into the office and have us recommend the specific products that we think is going to work for you. And also, I want to say, if you have a product or a regimen you love, I'm never going to take away from that regimen. If this product works for you, that's great. But maybe we find another product that will complement your current regimen. And it could it's often actually one product that I'm adding for someone, or we start with one and then maybe, a few months later we add a second one. So this does not have to be a regimen overhaul, but there are specific products that are really, really improve your texture. So, Alyssa, what we'll do is we'll go over your products and we'll make some recommendations based on what you're using. Okay. So moving on, chemical peels. So chemical peels can be used on a spectrum. So you can have very mild chemical peel that works mostly microscopically on the cellular level to exfoliate and make the skin brighter. And then you can have on the other end of the spectrum some deep peeling, which results in shedding like a snake, but reveals baby fresh skin underneath. So we have pretty much a full spectrum here to a certain extent, but most of what we do are very mild peels with the estheticians. And these peels are really, really effective. They can help pigmentation, as you can see in the photo of our patient. They can help redness. They can help get rid of acne. They can help with pores. So it's a really great glow up. And this is something that can be started. You can do some aggressive peels starting ASAP before your event. And then as the event gets closer, you do more conservative peels where there's little to no downtime, or you switch if you have a shower, if you have, like I said, reception, you can switch to something that's a little bit gentler as the time gets closer and little downtime is needed. But peels are a really great way to help the texture. As you may have heard, we just launched this newest, latest, and greatest laser called the Ultra Clear. This is a fractionated ablative treatment. So it's a fractionated erbium treatment. And what's really cool about this particular laser is it has very sophisticated software where we can completely customize the treatment. So we can help someone like this in the photo where there's acne scarring, we need a lot of texture changes, or we can do something like a light treatment that will give a really amazing glow with one treatment, not a series of treatments like the peels sometimes can be. It does have some downtime, but with a light treatment, that downtime can be as little as 3 days. With a more aggressive treatment, it's more like a 1 week downtime, but it's a really comprehensive treatment, and especially for texture, but also brown spots and wrinkles. So this is a great treatment for someone who doesn't want to be in the office very much and who doesn't mind downtime and who also wants a really great change for their skin. Okay, oh my gosh, I'm getting poll shy here, guys, but here's another poll. The good news is repetition leads to learning. So here we go. Can you guys see this poll? Did you hit launch? Okay. All right, guys. Do you feel like your skin tone looks even in flash photography? No, and depends on the makeup. Ooh, somebody said yes. That's amazing. Kind of depends on the flash. I mean, if it's overexposed, yeah, it flashes everything out. But I mean, for the wedding, it's gonna show everything, guys. Everything. Okay. So we want you to feel confident in all these photos. We want every photo to be a good photo for you. So that's the goal, and that's what these treatments are going to do for you. Okay, so leading on to that, you can see these patients do not have even skin tone in flash photography. So you can see the pigmentation here, you can see the texture changes here. We want to avoid that. So again, chemical peels. Look at this beautiful patient with not much work. She was able to get glowy, beautiful skin. She doesn't even have to wear makeup. And it does a little bit of everything. Okay, here's the Ultra Clear again. Look at that beautiful, beautiful results with a couple of treatments, but look how much smoother the skin is and how much better it looks. Look at the glow compared to the before. And also that patient had melasma. You can see the uneven pigmentation, and it's much better after 2 Ultra Clear treatments. Okay, so let's talk about wrinkles. We talked about this a little bit. The dynamic wrinkles are those are expressive wrinkles. And then the static ones are the ones that are left even when Botox is in place. So the picture on the left, you know, we all love Jennifer Aniston, and she's so beautiful. But maybe we can soften those lines just a little bit. They don't have to be completely gone, but if they were just a little bit softer, she would look more youthful. Same thing on the right. Sarah Jessica Parker is amazing. Here, she's got so much Botox, she doesn't have any expression lines except the areas where the Botox is not working as well. So underneath the eyes, the laugh lines, the nasolabial folds. So we want everything to match. We don't want you to be so smooth that your normal expression lines look weird, like what happened to me and what we see in that photo. So we are, with big events, we're gentle with the Botox, and then we also treat the dynamic lines, or the lines here, here, underneath here. Oh God, another poll. Okay, here we go. Okay, so here's the poll. Are your lines visible only when you move, or are they visible at rest? So this is dynamic versus static lines. What do you guys say? So only when I move, so that's a Botox thing. Even at rest, that's a filler or a biostimulator thing. And not sure that, well, we'll talk more about it. Awesome. Okay, perfect. Okay, so here are the dynamic lines. This is something that Botox or similar would help with. So a neuromodulator would help with this. This is a forehead. Okay, these are the crow's feet. Again, they don't have to be as smooth as the person in this picture. This is just a good before and after. But again, a lot of times in this area, I like to see some expression lines for a wedding because it just kind of emulates how happy someone is. Okay, and the Ultra Clear, so this is going to help with some of those dynamic or stable wrinkles. So look at her lower face, and you see some of those lines are gone in the after treatment. And then also around her eyes, you can see in the before picture, the lines around her crow's feet, even though she's not smiling, they're there. And then they look like they're almost gone or gone in the after treatment. So that's a way that this laser can reduce even the lines that are there at rest. Okay, finally, let's talk about the structure of the face. So the structure is where the face is at. So we start out with most of the face up here. over time, it tends to come here and it makes our skin look square, makes our face look square and older and more masculine if we're a woman. So you can see on the left, she looks amazing. She's so beautiful. But if I feel like I could lift her skin a little bit more to make her facial shape a little bit more heart shaped, and she would look even more beautiful and more feminine. On the right, Nicole Kidman, again, she's beautiful, but she's got pretty significant hollowing in this photos. And sometimes it's just the angle of the photo. But I feel like if that was an accurate depiction of her anatomy, I would just fill in some of that hollowing and blend it a little bit. And that would make her look more youthful and less pulled and less sort of harsh. Okay, poll time. If you could change one area for better contour, which area would it be? In other words, do you want to see your cheeks change, your jawline change, underneath the eyes, lips? So lips are popular. Okay, we've got some jawline. I so agree with that. And some cheeks. Okay, pretty balanced. Interesting, no one's saying underneath the eyes. Okay, somebody just did. Thank you. Okay, so now we're officially balanced. All right, we'll end this poll. So these are all things we can treat with fillers or something called biostimulators. Biostimulators is what something, biostimulator is a category that's used for Sculptra and Radiesse, which are two things that can be used to lift the skin, but they greatly depend on your body stimulating collagen. So they do take a little bit of time to kick in, but they are just awesome as well. And sometimes we mix and match. So here's an example of a filler before and after. This woman had never had anything before. I actually used her at a course I was teaching, and I did some filler in, I think I was assigned the mid face, so like her cheeks and her jawline area. And you can see she got a really, really great but subtle lift. And this is one of those patients, it's even better in person, but also when I lifted her jawline and cheeks, you can see it pulled from the neck as well. So you can see her neck is a lot tighter in the second picture. So we are taking everything from the lower face and we're redistributing it back to where it used to be. And it doesn't look crazy, you guys. It looks like you, just a younger version. So look at her on the right. She looks, like herself, obviously, but everything's elevated and she looks a lot softer. You can see that her cheekbones are just kind of blended. She doesn't look super hollow. Everything looks super soft in her cheeks and her jawline, but less jowling, less neck laxity, even though I didn't treat those areas. Here's a beautiful photo, just shows some contouring and some evenness of the symmetry. Sculptra, I just mentioned, beautiful, beautiful patient who used to work with me. So she had some Sculptra in over a couple months. You can see the beautiful lift and contouring of her cheeks. And that's not a filler. It's just simply her own collagen filling in where I placed the Sculptra. Oh, and because it's collagen, you can see, look at her beautiful glow. Look at her cheek and how it's glowing in the after photo. That's a result of the new collagen that the Sculptra stimulates. So Sculptra is really great for a glow, as is this Radiesse, which is also a biostimulator. Here's another example of an older patient. Everything's just softer, just lifted up a little bit. So instead of falling forward towards her mouth, everything's pulled back a little bit. Supernatural result. So this is a lovely woman I work with now, and we did some Radiesse on her. We're still waiting for her full results, but you can see a few things. Number one, you can see her cheek is slightly elevated and lifted. Number two, you see the glow of her skin because the Radiesse has stimulated her collagen. So she looks a lot glowier in the after picture. And also, because I have contoured her cheeks, you see that the light is reflecting right where we want it to reflect, right off the cheeks. So if you were like a professional makeup artist, I think you would do the highlighting right on her cheek there, where you see that light, right?
Yeah.
And then also you can see the texture improvement of the acne scars. So that's a result of the collagen stimulation too. And we've got another example of radius here. So you can see the jawline definition, and she wanted a little bit more contouring. This is someone who's young. She wanted more definition of her cheeks. So that's what we gave her. Okay, and finally, SoftWave. This is a device that lifts without any needles. So completely non-invasive. It will stimulate your collagen. It actually stimulates elastin to make the skin less droopy. And it lifts. I mean, it lifts a little bit, not like a surgery, but it's completely non-invasive. And this is a result I just love because it's very natural, but very impactful. And you can see this young patient here. She had one treatment. It takes about 3 months to see the full result because we are stimulating collagen. And you can see, look right underneath her eyes. You don't see those lines that you see in the before picture because her cheeks have lifted. Do you see how the skin looks healthier? Look at her under eye areas in the before. It's a little purplish because the skin is thin there. And the after, her skin is thicker, so we're not seeing sort of that translucent vasculature in the after picture. And then look at her lower face. Again, she's young, she's beautiful, but she had a little bit of extra skin right here. And it's lifted in the after picture. So this is subtle yet impactful, and it's very easy as a patient. So same thing here, you can see same weight, but after she's had a couple of treatments, you can see her lower face, it's much thinner. She has more definition of her cheeks. Finally, same thing here from a side view, it's different patient. Weight is the same, but we see definition of her jawline, and look at her cheeks before and after. You see a much healthier contour in the after. Also, look at the readiness or the redness of her baseline versus after. That's a result of the new collagen. The skin is healthier, so it's not going to be as ready. So this is a really great technique. And this is a treatment that only has to be done once a year. I recommend 2 treatments, spaced 3 months apart, and then after that, annual maintenance if you choose to do so. Okay, so here's the thing, guys. You cannot put this off. You have to start building your foundation. So when it gets closer to the wedding, you're going to feel relaxed, you're going to feel confident, you're doing the last minute wedding stuff, and you're not worrying about this. Even if you don't have an event, I never regret doing a treatment for myself, because when it's like a really busy time of year, like holiday time or summer vacation is coming around, and I haven't had time to take care of myself, but I still get compliments, it just like the best feeling, you know?
It is. Confidence is key.
Confidence is key. Okay. So you can see this is why you need to start now. And look at this. We even have this cute little timeline for you. So, you know, depending on what you're thinking and your level of comfort, this would be your approximate timeline. But I really want to encourage you to come in and have a personalized plan for your own event and your own face, because everyone has a different starting point and everybody has different goals. But I feel like this is really helpful because it just kind of lets you know what things you should be doing first versus last minute. Okay, here she is. So, having worked here for 3 years, you've had a medical grade regimen
Yes.
that we're going to review. Okay. And you've had previous cosmetic treatments. So you've had neuromodulators, the last time being in November, about 4 months ago. And then you had some lip filler about a year ago.
A year ago.
Do you feel like that's still there, or okay?
I think it went away already.
So what do you think? What would you like to see for your wedding? If you could choose. Let's go to your photo here. There we go. Okay.
Yeah, definitely brighter looking skin.
Okay.
More even skin tone.
Okay.
And then a little bit more plumpness, especially in the lips. Yep.
Okay.
And then I don't know, I would probably consider like the jawline at some point, making it a little bit stronger, but
Okay.
yeah.
Yeah, let me take a look at you in person. I agree. You know, the first thing that kind of happens to people is this area.
Yeah.
You know, we kind of start like getting a little bit like things start coming down here. So I think like maybe supporting your cheek right here. And then I agree, jawline,
Yeah.
just two little areas, I think. And then lips.
Lips.
I agree. Yeah, that side picture would be so pretty if your lips had just a little bit more projection.
Yes, definitely. I agree.
Yeah, but I think your chin looks good, you know? I mean, maybe if we had an extra jawline photo, we could put, or jawline filler, we can put a little bit like right here to enhance the chin projection, especially if we're going to do the lips, and then like a tiny, tiny bit, just we'd borrow it from the jawline and put it right there.
I love it.
That'd be cool.
Yeah.
Okay. So I have here your makeup was settling into your pores and texture, and you mentioned texture earlier. And so that was something that maybe we talked a little bit off camera, maybe be willing to try the ultra clear laser for?
Yes.
Okay.
Yes. All the before and afters that I've seen, great results. I mean, how could you not want to try it?
It's really amazing. And I just treated my mother-in-law, and she came in a week ago and she had an aggressive treatment. So for you, we'd categorize you in like this superficial or even ultra light type of treatment,
Yes.
because we just want kind of like the surface glow.
Right.
But for her, you know, she's 75. She has some deep wrinkles. She doesn't do a lot of cosmetic treatments, very minimal. So I did an aggressive treatment. And it was crazy. The first 3 days, she's very red, very puffy. After it had been 72 hours, boom, like it was dramatic how quickly she healed. And that's like a 75-year-old. So I think even though the laser is like very effective and very sort of, it's in the aggressive category, it's really cool how quickly it heals.
Yeah,
So
that's amazing.
yeah, I think that would be something that you could easily incorporate. And
Yes,
even though you'll be working,
working.
she'll be working every. So, okay, you guys, we're going to ask you. Oh, so here's your treatment plan line. So we just kind of like filled this out. She hasn't seen this, but like, say you're going to do everything. This would be kind of, so we're 4 months out right now. So if we wanted to do the ultra clear, we'd probably do it soon. And then, you know, 3 months out, that's when we can do the fillers, neuromodulators, and then we just maybe tweak them a little bit before the wedding to make sure everything's perfect. And again, we want them kind of soft. We don't want them frozen.
Right.
So it's nice to like do them a little bit in advance, and then you can kind of let it wear off a little bit. And then let's see. Oh, if you wanted to do the soft wave, that would be another thing to do maybe about 3 months out, because again, those beautiful results usually are kicking in right about the 3-month mark.
Yeah.
1 month out, brightening peel, that'd be a perfect time for a gentle peel where you're not like a snake shedding or molting, but you're like glowing right away. And that way, if you do have any events, you'll be good to go and feeling confident about that. If we need to tweak any fillers, you know, if we do have about a month, that's a great time to check in. And then 2 weeks out, we're going to be putting the final little tweaks. If you come in and you're like, I love how it looks, but this side's just, there's a tiny line right there. It's driving me crazy. That's a perfect time to just put like a couple units there and tweak it. And then wedding week, you just focus on your medical grade skincare that we've been doing this whole time and hydration. And then you take care of last minute wedding plans, but you are not worrying about your complexion at all during that time.
I love it. Yeah, that sounds great.
Amazing. Oh my gosh, she's going to be like wedding bride supermodel here. Okay, you guys. So this is like my favorite slide. After this discussion, what do you guys think that Alyssa should do? Say you only had to choose one. What would be the most important thing for Alyssa to do? 100% filler so far. Come on, guys. Everybody chime in. 100% filler still. Okay, biostimulator, Sculptra and Radius, ultra clear. No one's saying soft wave. Okay. Okay, so the winners are filler. That's the number one. Number two, biostimulators. Number three, 3 and 4 are tied, neuromodulator and ultra clear.
I'll do it all.
I love it. Well, I love it when motivated patients come in because it gives us the best results, honestly. So thank you guys for chiming in. I think this is like really, really exciting. You too can have these results, even if you don't have a wedding coming up. This is going to make you feel great no matter what's going on in your life. And like I said, even if there's nothing now, if you start now, you're going to feel great when something comes up. And even if you don't have time to come into the office and have something done. Okay, so thank you so much for joining us. Alyssa, thank you so
Thank you for having me.
much. So what we're gonna do, guys, I don't have time to do like the demo today, but what I'm gonna do, we're gonna do the demo and we're gonna do the ultra clear on Alyssa. And I had to check in with her earlier to make sure that was okay, but she is like 100% on board. We're gonna do the ultra clear. I'm going to email you a link to us doing the ultra clear. And then later we'll send some before and afters too, and probably of the fillers as well. All right. Thank you so much. That was super fun. I'm going to tell you guys, I'm going to tell you guys the promos. So the first promo is, and this is with me, Dr. Yonan, Maya, Dr. G. So any of us can do this for you. We are doing 40 units of your choice of neuromodulator, Botox, Xeomin, Daxxify, Dysport. We're going to do 1 syringe of filler. We have on there lip filler. That's probably the most common thing people are going to want, but we can use it anywhere. And then we're going to do one of those mild peels, and we'll decide based on your skin type and your goals what the percentage is going to be, but a mild TCA peel, which is good for everyone. And then you're going to get honeymoon travel kit. So I just designed these bags and we just received them. It's a canvas kind of Chloe-like tote, and we're all carrying them at the office. But inside, so you can take this on your honeymoon and it'd be great for the beach because it's canvas. And then inside you have these travel size products. So you have an Alastin, it's all Alastin brand, in fact. So it's an Alastin ultralight moisturizer, hyaluronic acid, and then Illuminate. So the hyaluronic acid and moisturizer are going to keep your skin hydrated and stimulate collagen. And the Alastin Illuminate is going to give you a glow. So it's going to help with blotchiness and brown spots. So perfect travel size. And this is yours for $1,350. So you save $400 on this. And this is something you don't have to have an event. I think anybody can benefit from this. This is something that even if you're not sure, everyone can use filler, Botox, and a peel. It's very sort of entry level type of treatment. Level 2, this is with our nurse Maya. So Maya is going to do a soft wave on your jowls. So she's going to take these babies and lift it up here, just like what you saw in the photos. Completely non-invasive, no needles. And then she's also, in the same session, going to do some Botox on you, 40 units of neuromodulator, and you get the honeymoon travel kit as well. You're going to save $660 on this, and the cost is $1,500. Again, this is something that everyone could benefit from. I would absolutely do this treatment. Someone 10 years younger could benefit from this treatment. Someone 20 years younger, alas, for me, could benefit from this treatment. And then finally, the platinum package, such a cute name. So we are going to do an ultra clear for you, and we're going to do a moderate. So this is great if you really want tightening around your eyes and or your mouth. It's really, really great, but you're going to get full face glow and then help with some smile lines or texture in those areas. You're going to get a vial of Sculptra, which is going to lift your skin and give it a glow. So we're glowing ×2 here. And then we're going to do 2 syringes of filler. Now, even if you are young like Alyssa, you will benefit from at least 2 syringes of filler. Alyssa will probably use at least 3, maybe more, because she wants to do here, she wants to do here, she wants to do here. So 2 syringes is not too much. If you are older, if you're older like me or older, then that you will still benefit from this because the Ultra Clear is going to be really good for fine lines and wrinkles. The Sculptra is good for fine lines and wrinkles and lift, and we could all use 2 syringes of filler. So you guys are going to save over $1,000 on this package. We have 8 of these available. All of these do have to be done in one day because our overhead is very high, and we don't have the margins to support multiple treatment days. But this is absolutely doable for one day. The cost of this is $4,000 and you save $1,050. So if you have questions, please put them in the chat. I am going to send you an email with Alyssa's treatment, Ultra Clear treatment, and some Q&A answers if we get any Q&A for the chat. But otherwise, you guys have a wonderful, wonderful day, week, and I hope to see you in the office soon. Thank you so much.